Hello to all. Let us continue our course of solving the MCQs in BCBR. Now, this is the sixth chapter, Analytical Study Designs. Let us see the first question. Exposure is not assigned by the investigator in the following study design. The options are A. Cohort study, B. Case control study, C. Cross-sectional study, or D. All of the above. Once again, let us see the question. Exposure is not assigned by the investigator in the following study designs. Options are A. Cohort study, B. Case control study, C. Cross-sectional study, and D. All of the above. So what is the answer for this question? The answer for this question is option number D, that is all of the above. All of the above is the answer for this question. Now see the information given in this chart. This chart is regarding a brief classification of different types of epidemiological studies. It depends or it goes as follows. Did the investigator assign an exposure? If yes, then that goes into an experimental study. If there is no exposure, then it goes into a observational study. Further, the experimental studies are classified into randomized control trial and non-randomized control trial if there is random allocation and no random allocation respectively. But in the observational study, if there is a comparison group, then it goes into a term called as analytical study. If there is no comparison group, then it is called as a descriptive study. This analytical study is further divided into three types. Either it can be a cohort study, case control study, or a cross-sectional study. If the study goes from exposure to outcome, then it is a cohort study. If it goes the other way, that is from outcome to exposure, then it is called as case control study. If exposure and outcome are studied at the same time, then it is called as cross-sectional study. So these are the three different types of analytical studies which come under the observational study because of a comparison group allocation. Please remember this point. Because the investigator has assigned the exposures. So please be thorough. All the students, I request them to be thorough with this chart because at least 2 questions can be given from this chart. Coming to the next part, that is in the observational study. If there is no comparison group, then you have the descriptive study. So once again, you revise this chart thoroughly. That did the investigator assign an exposure? If yes, then it is an experimental study. If no, then it comes under observational study. Further, the experimental study is divided into randomized control trial and non-randomized control trial based on random allocation. If yes, then it is RCT. If no, then it is non-RCT. And in the observational study group, if there is a comparison group given, then it is called as analytical study. If there is no comparison group, then it is descriptive study. Analytical studies are further divided into case control study, cohort study, and cross-sectional study. To further analyze, I will tell you that if you take this cross-sectional study into consideration, cross-sectional study can be divided into two types, that is a descriptive type of cross-sectional study and analytical type of cross-sectional study. So this is a different entity altogether. As far as this chart is concerned, please remember this chart carefully and please remember this question and also the answer for this question. Next question. Which of the following statements is true about the cohort study? Let us see the options. A. It is not suitable for disease with a long latency period. B. Loss to follow-up can introduce bias. Or C. Both A and B. Or D. None of the above. So once again, which of the following statements is true? They are asking what is true about the cohort study. So let us see the options again. That it is not suitable for the disease with a long latency period. Yes, it is a true statement. And loss to follow-up can introduce bias. Yes, even this is a true statement. Now let us see this chart regarding the cohort study strengths and weaknesses. These are the strengths and these points are regarding the weaknesses. Each and every point has been asked as a question previously. Coming to our answer, in our question, the options they gave were that cohort study is not good for diseases with a long latency period. This was the option. And also differential loss to follow up can introduce bias. Even this was given as an option. Now see over here. It is not suitable for diseases with a long latency period and loss to follow up can introduce bias. So we have taken both A and B as the correct statements pertaining to the cohort study because both of these statements are actually the weaknesses of cohort study, but they are true statements. So therefore, among the weaknesses that the cohort study is not good for diseases with a long latency period and also loss to follow up can introduce a bias are 2 points or 2 statements inside the weaknesses of the cohort study. Also to mention, that the cohort study is not good for rare diseases, not good for rare diseases. Please remember this point. Cohort study is not good for rare diseases. This statement has been asked as a question many times. And another weakness is that this cohort study may have to follow large number of subjects for a long time, so therefore it is expensive and time consuming. This is also a question. This is also a question. This has been asked many times. This has been asked many times. So once again, we'll revise the weaknesses of cohort study. Number one, that it is expensive and time consuming because it may have to follow large number of subjects for a long time. Secondly, the weakness is that it is not good for rare diseases. Third thing, it is not good for diseases with a long latency period. Fourth thing, that differential loss to follow up or loss to follow up can introduce a bias. Now let us see the strengths of cohort study. Number one, it allows calculation of incidence. Allows calculation of incidence. Please remember this point. Which is the study which will allow the calculation of incidence is cohort study. Second one, you can examine multiple outcomes for a given exposure. Multiple outcomes for a given exposure. This has been given as an option. This has been given as an option. Then there is clarity of temporal sequence. This is also has been given as an option or a question anytime. And it is most important. It is good for investigating rare exposure. Rare exposures. Please remember. See, concentrate on this point. The strength of a cohort study is that it is good for investigating rare exposures, whereas the weakness, it is not good for rare diseases. Please remember. So I request all the students, whenever this question comes pertaining to cohort study, please read the question carefully. If they ask or if they are mentioning, is it good for investigating rare exposures, then it comes as a strength of the cohort study. If it is not good for rare diseases, then it comes as a weakness of the cohort study. So please read the question carefully. As far as our question is concerned, these two were given as an option because both of these options were weaknesses of the cohort study. So please remember this question, the answer for this question, and also the chart and the strengths and weaknesses of cohort study. So therefore, option number C, that is both A and B, are true. So please remember the question and the answer. Next question. Which of the following study design is better suited to demonstrate a temporal association between exposure and a disease? Okay. So which of the following study design is better suited to demonstrate a temporal association between exposure and disease? Options are A, cross-sectional study, B, case control study, C, cohort study, or D, ecological study. So from exposure to disease is nothing but the outcome. Okay. So what is the answer for this question? Answer for this question is C, cohort study. C, cohort study. Next question. Relative risk of more than one indicates what? The options are A, incidence in the unexposed is higher than the exposed, or B, incidence in the exposed and unexposed are the same, or C, that the incidence in the exposed is higher than the unexposed, or D, relative risk is significant. So RR, more than one, is what? So from the options given above, the answer is option number C, that is incidence in the exposed is higher than the unexposed. Now see the information given in this chart pertaining to interpreting the relative risk. The relative risk will be applicable to cohort studies, whereas the odds ratio will be applicable to case control studies. Now, if the relative risk is equal to 1, then the incidence in the exposed and unexposed is the same. If the relative risk is more than 1, then the incidence in the exposed is higher than the unexposed. If the relative risk is less than 1, then the incidence in the exposed is lower than the unexposed. If the relative risk is equal to 1, then the incidence in the exposed and unexposed is the same. So please remember all these three interpretations of relative risk. RR is equal to 1, more than 1, and less than 1. In our question, they have asked the relative risk of more than 1 indicates what? So we have taken the answer that the RR more than 1 is that the incidence in the exposed is higher than the unexposed. So please remember the question, this chart, and the answer for this question. Also to mention that if the relative risk is equal to 1, then it implies that the exposure is not associated with the disease. If the relative risk is more than 1, then it implies that the exposure is positively associated with the disease. If the relative risk is less than 1, then the exposure is negatively associated with the disease. So whatever is there, first they are speaking regarding the exposure and then the disease. Please remember this point. In our cohort study, we are going from exposure to the disease. So exposure to disease, exposure to disease, exposure to disease. So please remember, see once again, exposure, disease, exposure, then disease, exposure and disease. So there was one question which was asking, where does relative risk apply? It will apply to the cohort study. Okay, so please remember that interpreting relative risk, RR is equal to 1, more than 1 and less than 1. So please remember this chart carefully, the question, the answer for this question and also this chart. Next question. If the odds of exposure among cases is lower than the odds of exposure among the controls, then the odds ratio will be what? Odds ratio. Okay. So once again, the question, if the odds of exposure among the cases is lower than odds of exposure among the controls, then the odds ratio will be what? Options are A, more than 1, or B, less than 1, or C, it depends on other factors, or D, none of the above. If the odds of exposure among the cases is lower than odds of exposure among the controls, they are speaking regarding the case control study. Odds ratio will be applicable for case control study. So the answer for this question is option number B, less than 1, less than 1. Now see this information pertaining to interpreting the odds ratio. Odds ratio is applicable to case control studies. Please remember this point. And relative risk will be applicable to cohort studies. So if the odds ratio is less than 1, if the odds ratio is equal to 1, more than 1 and less than 1. If the odds ratio is equal to 1, then what does it imply? That the odds of exposure among the cases and control are the same. If the odds ratio is more than 1, then it implies that the odds of exposure among the cases are higher than the controls. And if the odds ratio is less than 1, that it implies that the odds of exposure among the cases are lower than the control. Also to mention that if the odds ratio is equal to 1, then the exposure is not associated with the disease. If the odds ratio is more than 1, then it implies that the exposure is positively associated with the disease. And if the odds ratio is less than 1, that it implies that the exposure is negatively associated with the disease. So I request all the students to please be perfect with the interpreting odds ratio, because one question can be asked from this chart itself. So please remember the question, our answer that we have taken this less than 1 as the answer for this question, and also this chart and the interpretation of odds ratio. Next question. All the babies born in a particular year will form a birth cohort. Will they form a birth cohort? Is it a true statement or a false statement? All the babies born in a particular year will form a birth cohort. The answer for this question is that it is a true statement. All the babies born in a particular year will form a birth cohort. Please remember the question and the answer. Next, again, true or false? Cohort study is suitable for rare diseases. Is it a true statement or a false statement? Cohort study is suitable for rare diseases. So this statement is definitely a false statement. A false statement. Please remember the answer. Now see this discussion over here regarding the cohort study strengths and weaknesses. In this, we have already spoken that the weakness of the cohort study is that it is not good for rare diseases. It is not good for rare diseases. Please remember this point. Cohort study is not good for rare diseases. And in our question, they have mentioned that cohort study is suitable for rare diseases. So therefore, we have taken that it is a false statement. This is a false statement. So cohort study is good for rare exposures. Please remember these words. Cohort study is good for rare exposures, but bad or not good for rare diseases. Once again, cohort study is good for rare exposures and not good for rare diseases. So these two differences you have to be very sure, because you can see this question that cohort study is suitable for rare diseases. It is a false statement. If they could have asked that cohort study is suitable for rare exposures, then the answer would have become true. But otherwise, because cohort study is suitable for rare diseases, it is a false statement, because the truth is that cohort study is not good for rare diseases, but it is good for investigating the rare exposures. So please remember this difference regarding the strengths and weaknesses of the cohort study. Next question. Which of the following is not true regarding the case control study? Which of the following is not true regarding the case control study? Let us see the statements. The statements are as follows. First statement, appropriate for study of rare outcomes. The second statement is more time consuming than the cohort study. Third statement, multiple exposures can be examined. Fourth statement, relatively expensive compared to cohort study. So which of the following is not true regarding the case control study? So of the options are as follows. Option number A, that both statement number 1 and 2 are not true. Option B, that the statement number 2 and 3 are not true. Option C, that both statement number 2 and 4 are not true. And option number D, that statement number 3 and 4 are not true. So what is the answer for this question? Which is not true regarding the case control study? So definitely out of these 4 statements, 2 statements are wrong and 2 statements are correct. The question is that we have to identify the wrong statements pertaining to the case control study. So the answer for this question is option number C, that is statement number 2 and 4 are not true. Statement number 2 and 4 are not true. That is, the case control study is more time consuming than the cohort study is a false statement, and also that the relatively expensive compared to the cohort study, case control study is relatively expensive to cohort study is also a false statement. Now let us see the small discussion regarding the case control study's strengths and weaknesses. These points are regarding the strengths and these points are regarding the weaknesses. So let us see the first strength, that it is good for examining the rare outcomes or outcomes with a long latency, which has been put as a option in our question. Now see over here that it is appropriate for study of a rare outcome. Then the second one, that it is relatively quick to conduct and it is inexpensive. This is also given as options. Case control study is relatively quick to conduct and it is inexpensive. Now in the options they gave that it was more time consuming than the cohort study, so therefore we have told that this is not a true statement. And also they have mentioned that relatively expensive compared to the cohort study, so that's why we have taken that this is not a true that this is a wrong statement. So therefore the option number 2, that is option number C, that is statement number 2 and statement number 4 were wrong, because case control study is less time consuming than the cohort study and it is less expensive compared to the cohort study. Now see over here the third point pertaining to the strengths of the case control study, that it requires comparatively few subjects. This has been previously asked as a question, and also in our question itself now they have mentioned that multiple exposures or risk factors can be examined. So all these are the strengths of the case control study. Now let us see the weaknesses of the case control study, that it is susceptible to recall bias. This has been asked once as a question. And one more weakness is that of the case control study, that selection of an appropriate comparison group may be difficult to select a comparison group. So therefore this is also a weakness. Third one, that the rates of diseases in the exposed and the unexposed individuals cannot be determined. Even this has been asked as a question previously. So all the students have to be perfect with the strengths and weaknesses of the case control study and also the strengths and weaknesses of the cohort study. As far as our question is concerned over here, we have identified the answer, that what are all the not true statements pertaining to the case control study. So please students remember the question, the answer, and also this chart pertaining to the case control study. Next question. What is an appropriate measure of statistical association in a cohort study? The options are A, prevalence ratio, B, risk ratio, C, its odds ratio, or D is Pearson's correlation coefficient. So what do we do in cohort study? We do relative risk. What do we do in case control study? We do odds ratio. Okay, so relative risk. So the answer for this question is, from the options now you can understand that the answer for this question is option number B, that is the risk ratio is the answer for this question. Next question. The entire population of a given community is screened and all those judged as being free of colon cancer are questioned extensively about their diet. So these people are then followed up for years to see whether their eating habits will predict their risk of developing the colon cancer. So this is an example of what study? Options are A, case control study, B, clinical trial, C is cross-sectional study, or D is cohort study? So from diet to the development of colon cancer is the study. They are following up for several years. What is colon cancer? Colon cancer is the outcome. What is the diet? Diet is the exposure. So I think you know the answer by this moment. From exposure to outcome, this method of study is the cohort study. Is the cohort study. Please remember the answer for this question. Next question. Exposure is assigned by the investigator in which of the following epidemiological studies? Exposure is assigned. Okay, chalo. Options are A, case control study, B, cross-sectional study, C, experimental study, or D, cohort study. By this time you should know the answer. The answer for this question is C, experimental study. Experimental study is the study where exposure is assigned. Next question. When a group of people with defined characteristics are followed up to determine the incidence is known as what? Options are A, case series, B, cohort study, C, case control study, or D, experimental study. We are having a group of people with defined characteristics are followed up to determine the incidence. So what is the answer for this question? The answer is very easy. It is cohort study. Cohort study is the answer for this question. Next question. Relative risk is what? Relative risk. Is it a rate? Is it a ratio? Is it a proportion or none of the above? Relative risk is for cohort study. It is a ratio. Relative risk is a ratio. Please remember the question and the answer. Next question. Relative risk of 1 in a cohort study indicates what? Options are A, incidence in unexposed is higher than the exposed, or B, incidence in the exposed is higher than the unexposed, or C, relative risk is significant, or D, that the incidence in the exposed and the unexposed groups are the same. Relative risk is equal to 1. So very simple answer, option number D, that is incidence in the exposed and the unexposed are the same. Please remember the question and also the answer. Next question. Women aged above 35 years were screened for HPV, that is human papilloma virus, and those who had HPV infection were then followed up for several years to predict the risk of developing the cervical cancer. This is known as WAS study. We know that this is a from exposure to outcome. It is cohort study. But what cohort study? Let us see the options. A, prospective, B, retrospective, C, case control, or D, cross-sectional. We know that this is not a case control or cross-sectional study. It is definitely a cohort study. It is a prospective type of cohort study because you are following up for several years. You are going forwards. Okay, so it is a prospective type of cohort study. Please remember the answer. Now see the information given in this chart pertaining to the types of cohort studies. There are three types of cohort studies. One is prospective cohort study, one is retrospective cohort study, and the hybrid type called as the ambispective cohort study. This comes in the center. In our question, once again, we have seen that the question was that the women aged above 35 years were screened for HPV, and those who had HPV infection were followed for several years. Okay, so what, as I told, that it is going from exposure to the disease. Exposure to the disease come in the cohort study. But what type of cohort study? It is prospective type of cohort study. See over here, it is a prospective type of cohort study. The study will start here, that is exposure, even before the exposure, and then the disease follows later. Okay, so the study is going in this direction. So this is called as a prospective type of cohort study. But if you see the retrospective type of cohort study over here, this is the retrospective type of cohort study. The study direction is going the other way. Actually, okay, the study is starting over here and it goes over here. Okay, from disease to exposure. So this is called as a retrospective type of cohort study. Actually, ambispective is that where it starts between, it may go either way, it will go either this way and also this way. So this is ambispective type of cohort study. So you have prospective cohort study, you have retrospective cohort study, and then you have the ambispective cohort study. As far as our question is concerned, please remember the question and also the answer, that this question's answer is prospective type of cohort study. Next question. Which of the following is appropriate regarding a cohort study? The options they have given the statements. Statements are A, Multiple exposures can be examined. Second statement is appropriate for studying the rare exposures. Third statement is it is expensive and time consuming, and fourth statement is appropriate for studying the rare diseases. So which of the following is appropriate? So what they have mentioned the options that both option number A that both 1 and 2 are correct, or B that both statement number 3 and 4 are correct, or option number C that statement number 2 and 4 are correct, or option number D that statement number 2 and 3 are correct. So for to answer this question you have to be perfect with the features of cohort study. So what is the answer for this question? The answer for this question is option number D, that is statement number 2 is correct and statement number 3 is correct, that the cohort study is appropriate for studying the rare exposures. It is not rare diseases. Please remember, it is appropriate for studying the rare exposures. Okay, then another statement which is correct from the options are that it is expensive, definitely, and it is time consuming. Cohort study is time consuming, you have to wait for long years. Next question, which of the following statement regarding the cohort study is false? Okay, so one statement is false and three statements are correct. Now let us see the options. Option number A, it is suitable to study a disease with a long latency period, or B, loss to follow-up can introduce the bias, or C, that the relative risk can be calculated, or D, temporal association with the risk factor can be established. So which of the following statement regarding cohort study is false? Let us see the options again. A, suitable to study a disease with a long latency period itself is a wrong statement. So we got the answer for this question. Now let us see the next options. Loss to follow-up can introduce bias in a cohort study? Yes, definitely yes. Relative risk we are calculating? Yes, even this is correct statement. And temporal association with the risk factor can be established? Yes, even this is the correct statement. So we got the answer for this question. Next question. Odds ratio of more than 1 indicates what? Options are A, odds of exposure among cases is lower than odds of exposure among the controls, or B, odds of exposure among the cases is equal to the odds of exposure among the controls, or C, odds of exposure among the cases is higher than odds of exposure among the controls, or option D, that the exposure is negatively associated with the disease. So it is simple question and also simple answer. Odds of ratio more than 1 indicates that the odds of exposure among the cases is higher than odds of exposure among the controls. So please remember the question and the answer. Next question. If there is a comparison group in a epidemiological study design, then it is called as what study? Comparison group. Options are A, descriptive, B, analytical, C, ecological, or D, none of the above. So we know the answer that whenever there is a comparison group in the epidemiological study, then it is a analytical type of study design. Please remember the question and also the answer and the flowchart. Next question. Which of the following statements about case control and cohort studies is correct? Options are A, case control study always establishes temporal association. B, cohort study establishes temporal association. Or C, cohort has lower level of evidence than the case control studies. Or D, that do case control for rare exposures and cohort for rare diseases. Case control for rare exposures and cohort for rare diseases. So which is actually a correct statement? So three statements are wrong and only one statement is correct. The answer for this question is option number B. That is, cohort study established temporal association is a correct statement, but rest of the three statements are false statements. Next question. In a study, 30 out of 100 patients who received a new drug developed an infection, while 60 out of 200 patients in the control group developed an infection. So what is the relative risk of infection in the new drug group compared to the control group? They are asking to calculate the relative risk of infection. Okay, so they have given options. Options are A, 0.25, B is 0.5, C is 1, and option number D is 2. In a study, once again let us read the question. In a study, 30 out of 100 patients who received a new drug developed an infection, while 60 out of 200 patients in the control group developed an infection. So what is the relative risk? The answer for this question is option number C, that is 1. Now let us see how we have the answer over here. What is the relative risk of infection is what they have asked. Now how do you calculate the relative risk? Relative risk is given by the formula. Relative risk is equal to A by A plus B into C plus D by C. This is the formula of relative risk. All the students, please remember this formula of relative risk. Once again, relative risk is equal to A by A plus B into C plus D by C. Now let us substitute all the numbers. First we will see exposed and then unexposed. Okay. So what are the exposed cases? How much? 100. Sorry, out of 100, 30 are exposed. Unexposed are 70. Then controls, 200 in the control group, out of which 60 are exposed. So and 140 are unexposed. Then next, we will substitute all the numbers. So this is A, this is B, and then this is C. Finally, this is D. Now we will put all the numbers. Okay. So relative risk is equal to A, that is 30 by A plus B. A plus B, 30 plus 60. 30 plus 60 is equal to 90 into what is C plus D? What is C? C is 70. 70 plus 40, 70 plus 140. 70 plus 140 is 210. 210 by 70. Okay. So now you have to calculate this. This one 3 3s are okay. So 3 7s are, this is 3 into 70 times. 70 goes. So this is answer. So the answer for this question is 1. So this is how we have come to the answer 1. I request all the students to please mug up this formula of relative risk is equal to A by A plus B into C plus D by C. Next question. A gynecology resident intends to determine the association between IUD, that is intrauterine device use, and the risk of extrauterine pregnancy. The investigator recruited 100 cases of extrauterine pregnancy and 200 participants who had intrauterine pregnancy as controls from the OVG ward of a tertiary care hospital over a period of 2 years. So both cases and controls were interviewed about the history of IUD use. Among the cases, 6 participants had the history of IUD use, and among the controls, 4 had the history of IUD use. To calculate the odds ratio of extrauterine pregnancies among women with the history of IUD use. So we have to calculate the odds ratio. The options they gave are A 0.32, B 1.39, C 3.12, or D 0.72. Let's see how do we calculate the odds ratio. Okay, they have asked the odds ratio of extrauterine pregnancies. What is the formula for odds ratio? Odds ratio is equal to AD by BC. Please remember this formula of odds ratio. In the previous question, we have seen the formula of relative risk and how to calculate relative risk. Now, odds ratio is equal to AD by BC. What is A, what is D, what is B, what is C? Let us see now. Now, what have they given in the question? Investigator has recruited 100 cases of extrauterine pregnancy and 200 participants who had intrauterine pregnancy as controls. Okay, so 200 participants are controls. Okay, then both the cases and controls were interviewed for the history of IUD use. So among the cases, now they are speaking regarding the cases. Among the cases, 6 participants had the history of IUD, and among the controls, 4 had the history of IUD use. So now we have got the numbers. Now let us put all the numbers where they are. Now let us see. First we will write exposed. Okay, and then I will write unexposed. Please concentrate over here. Spare some time. Don't be in a hurry. Okay. These are the cases. Then we'll write the controls. Okay. Now, what are the cases? Basically, how many are the cases? These are 100 cases. Okay. Out of this, how many were exposed? 6. 6 were exposed to what? IUD. Intrauterine device is the exposed. Okay. Not exposed in the sense no IUD, no intrauterine device. So this is not exposed. So 6 are the cases. And so how many will be the unexposed? 100 minus 6 is equal to 94. Then how many were controls? 200 were controls. You have seen these 200 participants are controls. 100 other cases, 100 other cases, 200 other controls. So 200 other controls, 100 other cases over here. So out of those controls, how many? 4 had a history. So you have taken 4. 4 are exposed to IUD. So how many are unexposed to IUD? 196. So 94 plus 6 is equal to 100. 196 plus 4 is equal to 200. Okay, so now we have got the numbers. Now let us substitute all the numbers AD by BC. Okay, so I will write over here odds ratio is equal to AD. AD in the sense, what is A? This is A. Okay, and this is B, this is C, and this is D. Okay, so AD in the sense 6 into 196 divided by 4 into 94. 4 into 94. So if you calculate this, whole thing, it will come to around 3.127. 3.127. So this is the answer for this question. So we got the answer for this question. Okay, so this is how you have to calculate the odds ratio. In the previous question, we have seen how to calculate the relative risk. Now here odds ratio. Please remember the formula AD by BC. And most important is how do you substitute the numbers. Next question. An investigator conducted a case control study with psoriasis patients as cases and other skin diseases as controls. So those having hypertension were considered as exposed and non-hypertensive as non-exposed. The study found an odds ratio of 1.45. So which of the following is correct? Options are A. Psoriasis is positively associated with hypertension. B. Odds of hypertension among psoriasis patients is lower than the odds of hypertension among patients without psoriasis. Or option number C, that the odds of psoriasis among hypertensive patients is lower than the odds of psoriasis among the non-hypertensive patients. Or option number D, that hypertension is a causative factor of psoriasis. So what is the answer for this question? Among the options, option number A, that psoriasis is positively associated with hypertension is the answer for this question. Next question. A prospective cohort study was conducted to determine the association between coffee consumption and the risk of pancreatitis among 1000 healthy participants. So among the participants, 3500 participants consumed coffee, whereas 6500 participants did not consume. So after a follow-up of 10 years, 85 participants in the coffee consumption group developed pancreatitis, 10 years of study. Whereas among the non-coffee consumption group, 130 developed pancreatitis. So calculate the relative risk of pancreatitis due to coffee consumption. So this is a cohort study. They are asking us to calculate the relative risk from the variables given above. The relative risk of pancreatitis due to coffee consumption. The options are A 0.04, B 0.85, C 1.21 or D 1.50. What is the answer for this question? So let us see that how have we calculated the relative risk of pancreatitis due to coffee consumption. So first of all, we will put the formula of relative risk. What is relative risk? Relative risk is equal to A by A plus B into, by this time everybody should be perfect, C plus D by C. So this is the formula of relative risk. Okay. Now what is A, what is B, what is C and what is D? We have to derive from the question. Chalo. Then let us see. We will write diseased and then you have the non-diseased. Non-diseased are nothing but the controls. Okay. Non-diseased are nothing but the controls. Then you have the exposed. Exposed to what? Exposed to coffee. Coffee exposure. That is coffee consumption. And then you have unexposed. Unexposed to coffee. Okay. So this will become A, this will become B, this will become C, and this will become D. Okay. Now the diseased people, that is people who got pancreatitis are how many? 85. 85 participants in the coffee consumption group developed pancreatitis. Coffee consumption with disease means pancreatitis. Okay, so pancreatitis and coffee consumption is 85. Among the non-coffee consumption, 130 in non-coffee consumption developed non-coffee consumption pancreatitis. So pancreatitis is the disease. 85 consumed and they got, 130 not consumed and still they got. So 130 over here. Total how many people are there among the participants? See over here in the third line. Okay, 10,000 healthy participants. So out of 10,000 healthy participants, among these participants, 3,500 participants consumed coffee. So exposure to coffee is 3,500. So how many people are unexposed to coffee? 6,500. If you minus 3,500 from 10,000, it will be 6,500. So this is how you have to derive all the numbers. What is A, what is B, what is C, and what is D. Please read the question carefully again and again, and then you substitute all the numbers. What is A? A is 85. 85 by 85 plus 3,500. So 3,585 into what is C? C is 130 plus 6,500 divided by once again 130. So how much it will be? It is 85 by 3,585 into 6,630 by 130. If you calculate this, it will come to 1.21. Please calculate for yourself. It will come to 1.21. So this is the answer for this question. This is how you have to solve. Most important is, first of all, you have to know the formula. Second is, you have to substitute all the variables, all the numbers. So what is A, what is B, what is C, what is D? You have to derive from the clue given in the question. So please practice this question again and again. Next question. All the following are elements of a cohort study except what? Options are A, that it involves calculation of incidence rate. B, it proceeds from exposure to outcome. C, it involves randomization of participants. D, it involves follow-up of the participants. All are the elements of a cohort study except. So 3 statements are correct and 1 statement is wrong. Option number A, that it involves the calculation of incidence rate. Yes, definitely it is a true statement. B, it proceeds from exposure to outcome. Yes, even this is a true statement. It involves randomization of participants is definitely a wrong statement. Randomization comes in the randomized control trials, RCTs. So that's a different study altogether. Finally, that it involves the follow-up of the participants. Yes, even this is a correct statement. So we got the answer for this question as option number C is the answer for this question. Next question. All the following are limitations of a case control study except what? So all the following are limitations of a case control study except. So there are 3 limitations except one. Options are A, that it can introduce the recall bias. B, incidence of disease cannot be determined. C, selection of appropriate control group may be difficult. Or D, it can introduce attrition bias. So what is not a limitation? Let us see the options again. It can introduce a recall bias. Yes, it is a limitation. Incidence of the disease cannot be determined is a limitation of a case control study. Selection of appropriate control group may be difficult. Yes, even this is a limitation in the case control study. So we got the answer that it can introduce attrition bias is not a limitation of case control study. Please remember the question and also the answer. Next question. Using medical records from a tertiary care cancer center, a researcher collected data on occupational exposure and lung carcinoma on patients admitted between 2000 and 2010. He is going back. Okay, the researcher is going back. Chalo. So he classified the patients who had the history of working in coal mines, coal worker pneumoconiosis as exposed and others as unexposed. So he then compared the frequency of lung carcinoma. Okay, they got carcinoma among the exposed and also the unexposed. So what best describes the study design? It is easy. From 2000 to 2012, he went retrospectively. So it is a retrospective type of cohort study. Directly will take the answer. Okay, so please remember this type of question and also the answer for this question. Next question. Pediatrician recruited 120 children with Crohn's disease and their matched sibling controls. So the researcher collected history of exclusive breastfeeding from the mothers. Presence or absence of exclusive breastfeeding was compared between the disease and the non-diseased children. So identify the study design in this research. So they have taken controls and we have the diseases also. So what is this? Is it a case series or B, cross-sectional study or C, case control study or D, cohort study? We got the answer from the question itself. We are comparing the cases, that is children with Crohn's disease, with their controls. So it is a case control study. Case control study, we got the answer for this question. Please remember the question and also the answer. Next question. If the relative risk of a disease after exposure to a certain chemical is 3, then what does that mean? Relative risk is more than 1. Basically, that is actually it is 3. Okay. So options are A, that the exposed group has 30% higher risk of the disease, or B, that the exposed group has 3 times higher risk of the disease compared to the unexposed group, or C, that the disease is 3 times as common in the general population, or option D, that the chemical exposure is responsible for all the cases of the disease. So if the relative risk of the disease of the exposure to a certain chemical is 3, then what does that mean? It means that the exposed group has 3 times higher risk of the disease compared to the unexposed. So we got the answer for this question. This is the answer for this question. Please remember. Next question. A multi-centric study was conducted to determine the association between diabetes and cataract. So the investigators recruited 1000 diabetics and 2500 non-diabetics. The participants were examined to exclude the presence of cataract at the time of recruitment. They were followed once yearly for 10 years to document the development of cataract. So the study found that the incidence of cataract among diabetics was more when compared with the non-diabetics. Identify the study design. All this is to confuse. What is important is that they were followed once yearly for 10 years. Okay. So they are doing what? Options are A, cross-sectional study, B, case control study, C, prospective cohort study, D is experimental study. From exposure to outcome, multiple times different varieties of questions were asked for this prospective type of cohort study. Please remember the question and also the answer. Next question. A study was conducted to determine the factors associated with malnutrition in under 5 children. The researchers screened 350 children from 25 randomly selected villages. So among them, 150 children were either underweight and or stented. Socio-demographic characteristics, birth history and childhood clinical history were recorded for the screened children. So what is this type of study design used over here? Is it A, descriptive cross-sectional study, or B, analytical cross-sectional study, or C, case control study, or D, prospective cohort study? Definitely it is not a prospective cohort study, it is not a case control study, it is not a descriptive type of cross-sectional study. The answer over here is that it is an analytical type of cross-sectional studies. Please remember the question and also the answer for this question. Next question. A gynecology resident intends to determine the association between pre-pregnancy weight and the risk of preeclampsia. The investigator recruited 50 women diagnosed with preeclampsia as cases and 50 women without preeclampsia as controls in a tertiary care hospital. So both the cases and controls were interviewed and asked about their pre-pregnancy weight and height. The pre-pregnancy body mass index was calculated for all. So among the cases, 15 women with preeclampsia and 5 women without preeclampsia had BMI of 25 kg per meter square. Calculate the odds ratio for the association between the preeclampsia and BMI. So we have to calculate the odds ratio. Options are A 1.1, B 1.5, C 2.8 and D 3.8. So what is the answer for this question? Now let us see that how have they calculated the odds ratio in this question between preeclampsia and BMI. Now you know the odds ratio, formula for odds ratio. Odds ratio is what? Odds ratio OR is equal to AD by BC. This is the formula. Odds ratio is equal to AD by BC. First you have the cases, okay, and then you have the controls, cases and controls. Then we have to take women with preeclampsia who are having BMI of more than 25, and then we have another group who are having BMI of less than 25. So out of the 50 cases, they mentioned 50 cases, okay, 50 cases, 50 women diagnosed with preeclampsia as cases and 50 women without preeclampsia as controls. So both of them are 50 and 50. Okay, so out of which what 15 women are over here. So how many will be without less than 25%? 35. They gave the number. Among the cases, 15 women. See over here. Among the cases, 15 women with preeclampsia and 5 women without preeclampsia and 5 women without preeclampsia. Preeclampsia without in the sense controls. So 5 women without preeclampsia. They are having BMI of more than 25. So if be in the BMI category of more than 25, we have put 15 women with preeclampsia and 5 women without preeclampsia. Okay, so if you have removed 15 women with more than 25 BMI, so with less than 25 BMI, how many will be there? 15 minus out of 50, if you remove 15, it will be 35. Similarly, over here, out of 50, if you remove 5, there will be 45. Okay, so this is A, this is B, this is C, and this is D. Now we will calculate the odds ratio. Odds ratio is equal to AD by BC. That is 15 into 45 divided by 5 into 35. So this will, if you calculate, this will come around 3.85. This you calculate for yourself. This will come around 3.85. So this is the answer for this question. Basically, what is important is how you derive the numbers from the information or the clues given in the question. Okay, you have to remember the formula and then you have to derive all the numbers. What is A, what is B, what is C, and what is D. Similarly, and then you put all, substitute all the numbers, and then you will get the answer. Next question. Which of the following is correct about OR and RR? What is OR? OR is odds ratio and RR is relative risk. Options are A, that OR and RR are always the same. That is odds ratio and relative risk are always the same. B, odds ratio can be used for cohort studies while relative risk only used for case control studies. Or option number C, that the odds ratio is larger than relative risk, especially for common outcomes. And odds ratio, option number D, odds ratio and relative risk measures the absolute risk of an outcome. So which of the following is correct? Let us see the options again. Odds ratio and relative risk are always the same. Definitely not. Odds ratio can be used for cohort studies while relative risk is used for case control studies is definitely not, because we know that odds ratio is for case control studies and relative risk is for cohort study. Then third option, odds ratio is larger than relative risk for common outcomes. Yes, definitely it is a true statement. This is the correct statement. What is the answer for this question? Then let us see the last option, that odds ratio and relative risk measure the absolute risk of an outcome, is also a wrong statement. Okay, so please remember the question and also the answer for this question. Next question, which of the following is an element of a case control study? The options are A, it starts with selection of study participants who are exposed, or B, it involves matching of cases with controls, or C, it includes randomization of cases and controls, or option D, that it involves prospective follow-up of cases and controls. So what is the element of a case control study? Case control study is what? From the options given, the answer is that it involves matching of cases with controls is the answer for this question. Please remember the question and also the answer. Okay. The other options pertaining to this question, let us discuss them also. That it starts with the selection of study participants who are exposed. It belongs to cohort study. This statement belongs to cohort study. Okay. Then third option, that it includes randomization of cases and controls. Randomization is not at all over here. Randomization comes to RCTs, that is it's a different entity. Then it involves prospective type of study. No, definitely not. It is prospective is cohort study again. Okay. So we got the answer for this question. Next question. A study was conducted to determine the association between coronary artery disease and age-related macular degeneration in people above 60 years of age. The investigators included 150 participants with age-related macular degeneration and 150 participants without age-related macular degeneration. The participants were interviewed for major risk factors for the disease. Among the participants with age-related macular degeneration, 25 had history of CAD, while among those without age-related macular degeneration, only 10 had history of CAD. So identify the study design in this case. Simple. There are cases and there are controls in this study. So the answer for this question is case control study. Simple as such. They have given a very big question, but the outcome is that this type of study is a case control study. Next question. A cohort study was conducted to examine the association between anemia and incidence of dementia in patients with newly diagnosed type 2 diabetes mellitus. The study included 4,000 participants aged more than 30 years of age who were diagnosed with type 2 diabetes between 2006 and 2010 and were followed until 2019. The anemia status was recorded at the time of enrollment into the study, and development of dementia was recorded between 2011 and 2019. At the end of the study period, 200 diabetics developed dementia in total. So among those with dementia, 90 were diagnosed with anemia, while among those without dementia, 1400 had anemia. So calculate the measure of association between dementia and anemia in the type 2 diabetics. So options are A 1.0, B 1.4, C 2.1 or D 2.5. What is the answer for this question? Let us see how do we solve this question. They have asked to calculate the measure of association between dementia and anemia in a what study? Cohort study. So in a cohort study, what will you do? Cohort study, you calculate the relative risk. So relative risk is equal to, what is the formula? A by A plus B into C plus D by C. So this is the formula for relative risk. Now we have to find out what is A, B, C and D in this question. So let us see once again. The study included 4,000 participants, okay, who were diagnosed with type 2 diabetes. So 4,000 participants already had diabetes. 4,000 participants already had diabetes. Now, out of which anemia status was recorded at the time of enrollment. So at the time of enrollment, they have started recording anemia. Okay. At the time of enrollment into the study, and development of dementia was recorded. So they have started recording dementia also. So at the end of study period, 200 diabetics developed dementia. So that means out of this 4,000, people developed dementia. Okay. So what does that imply? That 3,800 people, participants are no dementia. Okay. No dementia. Who? 3,800. So among those with dementia, that is among these 200 with dementia, 90 were diagnosed with anemia. So one more numbers, another number, 200 minus 90 is 110. Okay, this is one value. So 90 people are with anemia and dementia. 110 are no anemia with dementia. No anemia but with dementia. 90 are anemia, dementia. Okay. 200 is total dementia. Total dementia. Okay. Then finally, while among those without dementia, now we will speak about without dementia, that is 3,800 are without dementia, 1,400 are anemia. Okay. So total dementia are 200, 3,800 are no dementia. So out of this no dementia of 3,800, 1,400 had anemia. 1,400 had anemia. Anemia, no dementia. Okay. So if you subtract this, what will be the value? 2,400. 2,000 value have no anemia and then no dementia. No anemia and no dementia. Chalo. So now we got all the numbers. Okay. So let us substitute what goes into what. So we will form a tabular column. Now we will put the tabular column of dementia, no dementia. And then anemia, no anemia. So how many are anemia and dementia? Anemia with dementia are 90. Okay. Then how many are no anemia and dementia? They are 110. So 90 plus 110, 200. So we got the total dementia. How many are without dementia? 3,800. Okay. See this number, 3,800 without dementia. So anemia and no dementia. Anemia and no dementia are 1,400. Okay. No anemia, no dementia are 2,400. Okay. So 2,400 plus 2,400 plus 1,400 is equal to 3,800. We got the numbers. So what is what? Okay, so till now we have understood how to derive all the numbers from the question. Now let us calculate the relative risk. So we will substitute all the numbers. A by A plus B, that is 90 plus 1400 is 1490 into C plus D, that is 110 plus the 2400 is equal to 2510 divided by only C, that is 110. So if you calculate this value, if you calculate this, you will get the answer as 1.4. 1.4. I have calculated, you calculate for yourself. So this is the answer for this question, 1.4. So this is how you have to calculate this question. So all the students, please solve this question 2 or 3 times until you become perfect. Then remember the question and also the answer for this question. In 2020, a study was conducted by a researcher to determine the relationship between implanted medical devices and connective tissue diseases. The researcher selected 5,000 individuals who had a medical device implanted between 2000 and 2002 from the medical records department of a hospital. These patients' records were followed up to the year of 2019 for a diagnosis of connective tissue diseases. So it was observed that 20% of the individuals with the medical devices had developed a connective tissue disorder. Identify that study design in this case. It is very easy. Is it A cross-sectional study, B case control study, C prospective cohort study, or D retrospective cohort study? In which year they have conducted a study? They have conducted a study in the year 2020. So from 2020 they went back to 2000 and 2002, and from 2002 they followed up to the year of 2019, but the study was started in the year 2020. So what is this study? This is a cohort study. What type of cohort study? It is a retrospective type of cohort study. Please remember this answer. It is a retrospective type of cohort study. Next question. Which of the following is not an experimental study design? From the options are A randomized control trial, B cohort study, C non-randomized control trial, or D none of the above. It is very easy. Which is not an experimental study? Experiment. RCT is an experiment, NRCT is an experiment. Answer for this question is B cohort study. Cohort study is not an experimental study design, it is an analytical study. Next. All of the following are types of analytical studies except, once again, similar type of question. Options are A cross-sectional study, B case control study, C experimental study, and D cohort study. It is very simple. Answer for this question is C experimental study, because experimental study is not a analytical study. Experimental itself is a different entity. Rest of the things, case control, cohort, and cross-sectional are all analytical studies. Then next question. An investigator conducted a cohort study to determine the association between exposure to second-hand smoke during childhood and asthma in adulthood. The study reported a relative risk of 2.1 between asthma and exposure to a second-hand smoke. So which of the following interpretation is correct? Options are A. The incidence of asthma in children exposed to second-hand smoke is lower than the children not exposed to second-hand smoke. Or B. The incidence of asthma in children exposed to second-hand smoke is higher than the children not exposed to second-hand smoke. Or option C. The incidence of second-hand smoke is lower in children with asthma than in children without asthma. Or option D. The incidence of second-hand smoke is higher in children with asthma than in children without asthma. Very big question. And the answer for this question is option number B. That is, the incidence of asthma in children exposed to second-hand smoke is higher than the children not exposed to second-hand smoke. Next question. The following are true about a case control study except. Options are A. That it is suitable for examining rare exposures, B. It can be completed in a shorter duration, or C. It is relatively inexpensive to conduct, or D. That it is prone to information bias due to problems in recall. So the following are true about a case control study except what? Options are, once again let us see the options. A, that it is suitable for examining rare exposures. Yes, this itself is the answer for this question. That it is a wrong statement. The rest of the three statements, That it can be completed in a shorter duration, yes. It is relatively inexpensive, yes. And it is prone to information bias due to problems and recall, yes. All the three statements are correct. Option number A is incorrect, pertaining to a case control study. Next question. A researcher is following up a group of workers employed in aniline dye industry for 20 years to assess the development of skin cancers. The comparison group consisted of workers employed in the clerical job. The incidence of skin cancers was compared between the study groups. This is an example of what? By giving a comparison group, they are trying to confuse us. But they are doing a research on workers employed in aniline dye industry for 20 years to assess the development of cancers. Exposure is aniline dye. What is the outcome? Outcome is skin cancers. So you know the answer now. Options are A. Cross-sectional study, B. Cohort study, C. Case control study, or D. Ecological study. The answer is B. Cohort study. Next. A relative risk of 1 would denote what? RR is equal to 1. Options are A. The incidence among the non-exposed is higher than the incidence among the exposed, or B. The exposure is positively associated with the disease, or C. That the incidence among exposed is same as the incidence among the unexposed, or option number D, that the incidence among the exposed is higher than the incidence among the non-exposed. We have seen this previously also. The answer is option number C, that is the incidence among the exposed is same as the incidence among the non-exposed. Therefore, the relative risk will be equal to 1. Please remember the question and also the answer. Next question. Which of the following information about cohort study is incorrect? Options are A. Study population can be selected from the general population or subgroups, or B. Exposure status of the participants is collected at the baseline, or C. Individuals who had outcome of interest at the baseline will form the cohort, or D. Follow-up and outcome ascertainment in the exposed and the unexposed group should be uniform. So which of the following information about cohort study is incorrect? That is, 3 statements are correct and 1 is wrong. Let us see the statements again. Study population can be selected from general population or subgroups. Yes, definitely correct. Exposure status of the participants is collected at the baseline. Yes, even this is correct. Then individuals who had the outcome of interest at the baseline will form the cohort. Individuals who had the outcome of interest at the baseline itself will form the cohort is definitely a wrong statement. So this itself is the answer for our question. Now let us complete the last option. Follow-up and outcome ascertainment in the exposed and the unexposed group should be uniform. Yes, even this is a correct statement. Then next question. In a cohort study, 29 out of 1,530 individuals who received COVID-19 vaccine and 217 out of 1,880 individuals who did not get the COVID-19 vaccine developed severe COVID-19. The suitable measure of association in the above study is what? Options are A. Relative risk of 0.16, B. Odds ratio of 0.14, C is prevalence ratio of 0.14, or D. Relative risk of 0.14. What is the answer for this question? Now let us see how do we solve this question. So basically what have they asked? The suitable measure of association in this question, in this study. So what was the study? It was a cohort study. So what do you do in cohort study? Cohort study, we all know we do relative risk. So out of the 4 options, you can cancel directly B and C. Okay. So the answer will be either from A or either from B. Now what is the formula for relative risk? Once again, relative risk is equal to A by A plus B into C plus D by C. So this is the formula for relative risk. Now what is A, what is B, what is C, what is D? We have to derive from the clue given in the questions. So what are they speaking about in the question? In the cohort study, 29 out of 1,530 individuals who are receiving COVID-19 vaccine. Few people have already received COVID-19 vaccine. That is, they have exposed. And 217 out of 1,880 individuals who did not get in the sense unexposed people. So in both the categories, they have developed a disease called as severe COVID-19. So what does this mean? That there is also a control group who have not developed severe COVID-19. So 4 things. COVID vaccine, no vaccine, then you have a severe COVID disease, and then no COVID disease. So what are they? Let us put in the tabular form over here. So first of all, we will take people who are vaccinated. Okay, 29 out of 1530 individuals who received vaccine. 1530 vaccinated. Vaccinated are the exposed people. Okay, then non-vaccinated are how much? 1880. 1880 are no vaccine. So this comes under. So what have they developed? They have developed severe COVID. How many people have developed severe COVID out of the vaccination? You see over here, 29. 29. 29 developed severe COVID. Okay, out of the 1530. So you have 29. And from 1880, 217. 217. So this is 217. So what does it mean? When you have severe COVID, then you are non-COVID people. Non-COVID. So 29 minus 1530, you minus, how much it will come? It will come 1501. And this one, it will, if you minus 217 out of 100 and out of 1880, you will get 1663. Okay. So now you know what is A, what is B, what is C, and what is D. This is the most important point to come to a conclusion as to what is A, B, C, and D. This is the step. Okay. If you go wrong in this step, then the whole answer will go wrong. Okay. Now let us calculate further. What is A? 29. I. What is A plus B? A plus B. If you total this, what will you come? It is once again 1530 only. Similar. A plus B is equal to this 1530. Okay. Into C plus D. What is C plus D? 1880. By what is C? 217. So if you calculate this, the answer will come to 0.16. 0.16. Okay, I have calculated, you calculate for yourself, you will get the answer of 0.16. So this is how you have to answer this question. Next question. All of the following are true regarding selection of participants in a case control study except what? Options are A. Control should represent the distribution of exposure in the source population, or B. Controls are selected from the same source population that give rise to the cases, or C. Controls are selected depending on their exposure status, and D. Controls can be selected from population or healthcare facility or from the neighborhood cases or the neighborhood of cases. So all of the following are true except they have mentioned. So that means 3 statements are correct and 1 is wrong. Let us see the statements again. Controls should represent the distribution of exposure in a source population regarding the case control study. Yes, definitely correct. Then controls are selected from the same source population that gave rise to the cases. Yes, even this is correct. Controls are selected depending on their exposure status is definitely a wrong statement. So this is the answer for this question. Finally, the controls can be selected from population or healthcare facility or from the neighborhood of cases. Yes, also this is also correct statement. So we got the answer for this question. Next question. A researcher wants to determine the risk factors of mucormycosis among patients who had developed COVID-19. Steroid usage was compared between patients who developed and those who did not develop mucormycosis. This is an example of what? Steroid was compared between patients who developed and those who did not. So you have cases and you have controls. Chalo. Options are A. Cohort study, B. Case control study, C. Cross-sectional study, and D. Retrospective study. We know that this is a case control study. The answer is very clear. Next question. Persons with COVID-19 again in a patient in a hospital were asked for COVID-19 vaccination status. So an equal number of patients without COVID-19 disease were asked for COVID-19 vaccination status, equal number of people. And the responses in 2 groups were compared. The appropriate measure of association is what? Is it relative risk? Sorry, is it risk ratio or incidence density or odds ratio or prevalence ratio? It is very simple. Persons diagnosed with COVID-19 cases were asked for COVID-19 vaccination status, and an equal number of patients without COVID-19, that is controls. So what is the measure of association between cases and controls? It is odds ratio. So this is the answer for this question. Please remember the question and also the answer. Next, a researcher intends to determine the association between salt intake and hypertension. 100 out of 600 hypertension patients and 40 out of 600 patients without hypertension had high salt intake. Calculate the odds ratio for the association between salt intake and hypertension. They have directly asked. Odds ratio. Options are A 2.2, B 2.5, C 3.3 or D 2.8. So what is the answer for this question? Now let us see how do we calculate this question. They have asked us to calculate the odds ratio. What is the formula for odds ratio? Odds ratio is equal to AD by BC. Okay. Now you have to see what is A, what is B, what is C and what is D. Now from the question, a researcher intends to determine the association between salt intake and hypertension. So 100 out of 600 hypertension patients. So how many patients are there with hypertension? You have 600 patients. Okay. Out of which 100 people out of 600 hypertension patients have high salt intake. Similarly, 40 out of 600 patients without hypertension. So 600 hypertension, at the same time 600 no hypertension. Okay, 600 are with hypertension, 600 are without hypertension, and out of which 100 people have taken high salt intake, and over here 40 people have high salt intake. Okay, so we will put the box, this salt intake. Okay, so 600, 100 if you take out of 600, if you minus, then you have 500 people with no salt. You should have also people with no salt intake. And out of this, what will be, if you minus 40 out of 600, you will get 560, 560. So this is A, this is B, this is C, and this is D. So simply AD by BC. AD by BC in the sense A is how much? 100 into 560 divided by 500 into 40. Okay. So 14 by 5. 14 by 5. If you calculate this, the answer will be 2.8. 2.8. Okay. So this is how you have to calculate and solve this question. Then last question, which among the following is an advantage of cohort study compared to a case control study? Cohort over case control. Okay, options are A, incidence of disease can be calculated, B, less prone to loss to follow up of participants, or C, less costly and less time consuming, or D, that they are suitable for studying the rare diseases. So which of the following is an advantage of cohort study compared to a case control study? We know the answer. Advantage of cohort study is that the incidence of disease can be calculated. So this is the answer for this question. Please remember the question and also the answer.